Good evening. Welcome to the Understanding Your Gut webinar. It is my pleasure to introduce Dr. Kanika McNeil Moore, who is the Associate Vice President of Education and Diversity Engagement for the Crohn's and Colitis Foundation. Welcome, Doctor. You may begin.
Hello, and thank you for joining us. I will be your moderator for tonight's webinar. The Crohn's and Colitis Foundation is an organization that is dedicated to supporting individuals who live with inflammatory bowel disease, also known as Crohn's disease and ulcerative colitis. In my role, I have the opportunity to educate underserved communities on inflammatory bowel disease and gut health. Just like any other condition and diseases, it's important to understand any symptoms you may be experiencing within your gut. For example, are you living with frequent cramping, urgency, constipation, or any other digestive symptoms? If so, you are not alone. We will discuss the importance of gut health, what your symptoms may mean, and when and how to consult a healthcare professional. We have a full agenda plan that includes a presentation on gut health and gut health resources, an IBD advocate who will share her story, and a question and answer session in which you will have an opportunity to ask questions to our presenter by typing them in the questions box. Please note that all attendees will remain muted throughout the webinar. I would like to thank the Centers for Disease Control for providing us with a grant to host this program. At this time, it is truly my pleasure to introduce our keynote speaker, Dr. Ruby Graywood, who we are delighted to have with us this evening. Dr. Graywood is an attending physician in Montefiore and assistant professor in medicine at the Albert Einstein College of Medicine. Dr. Graywood's clinical focus is in Crohn's disease and ulcerative colitis. In 2007, Dr. Graywood received her Bachelor of Arts at Princeton University. She attended George Washington School of Medicine and Health Sciences, where she received her Doctor of Medicine in 2012. Dr. Graywood began her postgraduate training in 2012 with a 3-year internship and residency in internal medicine at Columbia University Medical Center. Following this, she completed a fellowship in gastroenterology at Mount Sinai Hospital, a school of medicine in 2018. Dr. Graywood's research focuses on improving the quality of inflammatory bowel disease, healthcare, and outcomes. She is also examining how social determinants of health influence the well-being of patients with IBD. Her work has been published in a number of peer-reviewed journals. Dr. Graywood is a board-certified gastroenterologist by the American Board of Internal Medicine and is a member of the American College of Gastroenterology and American Gastroenterological Association and the Crohn's and Colitis Foundation. Again, it is my pleasure to welcome Dr. Ruby Graywood. At this time, I will hand it over to you.
Thank you, Kanika, and thank you to the Foundation for the invitation, and thank you to all of you for joining us this evening to go over some of the fundamentals about gut health. So we'll start off with abdominal pain or stomach pain, which is a pretty common symptom. I imagine that many of us from time to time experience some discomfort in our abdomen, our bellies hurt a little bit. We might have some diarrhea or constipation. Maybe that comes and goes after a day or two. However, it's important to note when those type of symptoms aren't just common, infrequent, that come and go, and when they do require seeking medical attention. And so listed here are some symptoms, gastrointestinal symptoms and other symptoms that might alert you to when it's time to seek medical attention for your symptoms. So for instance, if you're having blood in the stool, either when you're moving your bowels or blood in the toilet bowl, that's an alarming symptom that you want to make sure to have follow-up. As well as any mucus in the stool or difficulty really completing emptying your bowels. So if you feel like you're going, but you're not fully emptying the bowels. Other symptoms that aren't necessarily gastrointestinal, but that would be important to pay attention to for seeking medical care include fatigue. If you're just feeling really run down, you're not clear on the reason why, or it's not improving even with rest, that could be a worrisome symptom. As well as having unintentional weight loss. So many of us are maybe trying to lose a couple pounds. This isn't that. This is when you're, losing weight and you really don't understand why. For children and adolescents, in particular, growth, either not reaching your milestones in growth or having stunted growth, those are also worrisome symptoms that would be a sign for you to seek medical attention. So that said, there are many reasons why you may have any of these symptoms. And so getting to the bottom of it is, why you would see a medical specialist. It could be anything from infections to more chronic conditions. And particularly when your symptoms are not going away, it's better not to, just ignore them or hope that things will take a turn with time. Really, time it plays in your favor the earlier you detect any condition. And so seeking medical attention when you do notice any worrisome symptoms, it's a good idea. So here are some general tips for how to go about finding a healthcare professional. So of course, if you have health insurance, you can check if you have a designated primary care provider. So a primary care provider is a great start for a lot of the basic testing, blood tests or stool tests, a lot of the basic testing that would be needed for evaluating any gastrointestinal symptoms that you may have. And that's a fine place to start. They could also refer you to a specialist if your symptoms warrant further evaluation. Things to keep in mind are how far you want to travel to see a specialist, for instance, or any other preferences that you have with respect to gender or to language availability. The foundation has an IBD Help Center, and that is a wonderful resource for you to use if you need some help, some assistance in trying to navigate finding a healthcare professional in your area. You should see on the screen, and I think you will have this available to you afterwards, a QR code there that can link you out to how to get in touch with the IBD Help Center. Now we'll go over a few of the common conditions, a few of the common reasons that would explain some of the gastrointestinal symptoms that we just went over. So the first one is irritable bowel syndrome, or IBS. So irritable bowel syndrome, or IBS, is what's called a functional gastrointestinal disorder. And so this is really a problem with the way that the bowel functions. So the exact reason why anyone develops irritable bowel syndrome is not completely understood, but we are increasingly understanding how the condition comes about through miscommunication or a disturbance really between the brain and the gut connection. So our brain and our gut are connected, and they send signals to one another all the time. And when there's a disturbance in this or a miscommunication between the two, that we call a disorder of brain-gut interaction, which is part of the explanation of what happens in irritable bowel syndrome. To this point, stress can often be a trigger for symptoms, aggravating irritable bowel syndrome. And the symptoms can range from abdominal pain to alterations to changes in the bowel function. And we'll go over some of the symptoms of irritable bowel syndrome next. So the symptoms of irritable bowel syndrome, or IBS, really can vary from person to person, but the real hallmark is chronic abdominal pain. So abdominal pain that's there almost every day and doesn't go away, and also accompanied by having changes in your bowel functioning. So constipation or diarrhea, or both constipation and diarrhea. There are other symptoms such as feeling gas or bloating or having nausea that can also go along with the other symptoms of IBS. So according to the International Foundation for Gastrointestinal Disorders, IBS affects at least 10 to 15% of adults in the US. Women tend to be affected more often than men. And it's actually irritable bowel syndrome, a diagnosis that is made very commonly, one of the most commonly diagnosed disorders in gastroenterology practice, and even frequently outside of that practice. So how do we make a diagnosis of irritable bowel syndrome, or IBS? So IBS is actually diagnosed based on symptoms. So when you're a clinician or a clinician seeing an individual with the symptoms that are characteristic of IBS, recognizes that, then they can make the diagnosis. You do exclude a few other conditions, but it's not IBS is not a diagnosis that requires extensive testing if your symptoms are consistent with a diagnosis, and other worrisome conditions are ruled out. So the classic features are listed here, which are abdominal pain associated with alteration in the bowel functioning, the frequency and the consistency. So more specifically, it's abdominal pain at least 1 day a week over the past 3 months, accompanied by 2 or more of the following. So having the abdominal pain related to bowel movements, either worsening or getting better, related to the abdominal pain related to the bowel movements. Having the abdominal pain associated with the change in the frequency of the stool, so more often having bowel movements or less often, and with the consistency of the stool. So the form of the stool looks looser, or it looks much more hard and pebble-like. So once a diagnosis of irritable bowel syndrome is made, what happens next? Well, there is not one treatment for all individuals with IBS, but some of the helpful first steps in treatment are related to diet. For everyone with IBS, are related to diet and to some changes in lifestyle. And so recognizing with your healthcare professional what are some potential dietary triggers of symptoms is a really helpful start, as well as in terms of lifestyle changes, what are some stressful or some stressors that may be triggering symptoms as well. So these diet and lifestyle adjustments can really help as a first line of treatment with any patient who has IBS. Beyond that, there is a role for medications, and depending on the symptoms, if you're having diarrhea, constipation, nausea, there are different medications that your healthcare professional would discuss with you and decide, and you would agree on to take as the next step. Importantly, as we mentioned, that IBS is a condition where there's a miscommunication between the brain and the gut. Part of the treatment options for IBS include psychological therapies or working with a mental health care professional. So there are many different types of therapies that a mental health care professional would discuss with an individual who has IBS, and two of the most common, or the two of the therapies that have the most evidence of benefiting people with IBS are cognitive behavioral therapy and gut-directed hypnotherapy. And listed on the screen here is a QR code where you can link out to learn a little bit more about those two different therapies. So next we'll move on to another condition called celiac disease. So celiac disease is an autoimmune condition in which a genetically predisposed person, when they ingest gluten, that leads to damage in the small intestine. Gluten is found in wheat, barley, and rye, and this ingestion really triggers the immune system. In someone with celiac disease, really triggers the immune system to produce pro-inflammation substances that lead to damage in the lining of the bowel. The immune system also produces antibodies against gluten and its other related proteins, and that can also contribute to damage in the lining of the small intestine. All of this left untreated can lead to other serious health problems in individuals with celiac disease, problems ranging from anemia to infertility or liver conditions. And so the treatment of celiac disease, or diagnosing and treating celiac disease, is important to avoid those complications. So who gets celiac disease? It affects actually 1 in 100 people worldwide, although only about a third of those individuals with celiac disease are properly diagnosed. There is a hereditary component, as we mentioned, that celiac disease occurs in people who are genetically predisposed. So the genes that you get from your mom and your dad, you're born with, that can give you the risk for having celiac disease. If you have a first-degree relative with celiac disease, that does increase your risk of developing celiac disease. What are the symptoms of celiac disease? So in terms of gastrointestinal symptoms, abdominal pain is a common symptom, but even just having bloating, gas, or changes in the bowel functioning, constipation and diarrhea are other symptoms. Noticing your stools look really greasy or fatty in the toilet bowl can also be another sign of celiac disease. We mentioned some of the complications that can occur, such as iron deficiency anemia, and this can be a common finding in celiac disease. And some of the symptoms that go along with iron deficiency are feeling weak or really just fatigued, really overtired, exhausted. One might notice paling in the lining in the eyes or in the mouth, or paleness in the nail beds. Other things like brittle nails or cold hands may also be a clue for symptoms that correspond with iron deficiency. How is celiac disease diagnosed? There are two main methods. One's a blood test and one is a procedure. So the blood test looks for the antibodies that we just talked about, that against the gluten proteins, and it can detect if someone has ingested gluten, those antibodies that are produced. The other test, which is a procedure, is an endoscopic exam, or an upper endoscopy. This is using a flexible device with a camera on the end to go into the mouth, the esophagus, and then to that first part of the small intestine, and taking little pieces of the tissue there to look under the microscope. And so there are characteristic findings when you look under the microscope that would clue into the diagnosis of celiac disease. Once the diagnosis is made, there are other tests, usually blood tests, to look for vitamin and mineral deficiencies that may occur with a person who has celiac disease and their bowel is damaged and not absorbing everything properly. So we talked about iron deficiency, also vitamin D, B12, zinc are some others as well. So how is celiac disease treated? The main treatment is a strict gluten-free diet. So the small intestine will have time to heal and begin to start absorbing nutrients and all the nutrients appropriately when gluten is eliminated completely from the diet. Many people with celiac disease find it helpful to work with a nutritionist or another healthcare professional to have nutritional supplements if they have any serious deficiencies, and to be under the care of a healthcare professional to evaluate for other signs and symptoms related to celiac disease, such as certain rashes that are characteristic of celiac disease. This often is on the elbows. And then rarely some complications of severe inflammation that can happen in the bowel, and that doesn't respond to just a gluten-free diet. And so though the gluten-free diet is the main treatment, continuing to follow up and make sure there are no other deficiencies in nutrition or complications is important. Listed here on the slide is also a link to a website from the Crohn's and Colitis Foundation that really gives hundreds of recipes and including gluten-free recipes, so that, although there's a dietary restriction, one can still enjoy the pleasure of eating and food and delicious foods. And so the Gut Friendly Recipes website there is a useful resource for finding those. And now we'll move on to another condition. Our last condition we'll discuss is inflammatory bowel disease, or IBD, not to be confused with the previous condition that we discussed, irritable bowel syndrome, or IBS. So we're talking about IBD, which is inflammatory bowel disease. So IBD affects nearly 1 in 100 people living in the US. And it is a chronic condition of immune-mediated inflammation of the bowel. So it involves the gastrointestinal symptoms, the differences between Crohn's disease and ulcerative colitis, which are the two main types of inflammatory bowel disease. The differences between those two have a lot to do with where in the bowel is affected, and we'll look at that in a slide coming up. And the symptoms actually for inflammatory bowel disease can vary from person to person. So sometimes even two people with ulcerative colitis can have different symptoms and different treatments. There's currently no cure for inflammatory bowel disease, but there are ways to manage the condition to help anybody living with IBD to have a good quality of life and live their best life. So it's interesting to note that by the year 2050, it's estimated that over half of the US population will be people from diverse communities, so Hispanic, Latino, Black, African American communities. This is also interesting because there's an increasing incidence of inflammatory bowel disease in the US, and more so among racial and ethnic minority groups. So the annual incidence, new people diagnosed with inflammatory bowel disease are currently, in the 20 range for if you're from white communities, and 13 range if you're from non-white communities. But the increase over time is estimated, or has been over. It's been 40% in white communities, but over 130% in non-white communities over the last 40 years. Also interesting is that the incidence is increasing among individuals who immigrate to the US from other areas, including areas of the world where there's a low incidence of inflammatory bowel disease in those countries, but then an increased incidence if individuals immigrate to the US. So I mentioned a little bit about Crohn's disease and ulcerative colitis, which are the two conditions in inflammatory bowel disease, or IBD. Crohn's disease can affect anywhere from the mouth to the anus. So the entire gastrointestinal tract can be affected by Crohn's disease, and the inflammation tends to be patchy. So it can be in one area of the bowel and skip some areas of the bowel and then it be in another area. This is different than ulcerative colitis, which occurs in the large intestine, which is also called the colon. So the large bowel, large intestine, colon, all the same thing. And that's what is affected in ulcerative colitis. Ulcerative colitis also tends to be continuous inflammation. So starting in the rectum and involving various segments continuously from the rectum, including sometimes the entire colon. So what are some common symptoms of IBD? These include diarrhea, having urgent bowel movements, like you'll have an accident if you don't go to the toilet right away, seeing blood in the stool or mucus, and feeling really fatigued or having nausea and vomiting. It's not entirely clear exactly what causes inflammatory bowel disease, but it is understood at present that there are many different factors that kind of come together and lead to the conditions of Crohn's disease and ulcerative colitis. So the genetics is one of the factors. There are over 200 genes that have been identified that are risk genes, and specific genes that occur in certain populations from certain ancestral backgrounds more so than others. But genes are part of what causes IBD, although not the main driving factor. It's believed that the gut or the bacteria in our gut also play an important role in the cause of IBD. So, all of us have millions of bacteria that live on us and live inside of us, and the bacteria usually are just living harmoniously with us. But in the case of inflammatory bowel disease, those bacteria actually can set off a type of inflammation, a chronic inflammation in the bowel, and that affects the immune system. And the immune system then has ongoing chronic inflammation. And so it's producing too many substances of inflammation. There are also aspects of the environment that are believed to play into the cause of IBD. And these include things in the environment, such as sanitation, tobacco smoke, the way that we process our foods. And so although we can't point our finger on one thing that causes inflammatory bowel disease, there are various risk factors that can lead to the conditions. So how is inflammatory bowel disease diagnosed? As I mentioned, there's no one single test. And so it's really under the care of a healthcare professional who would perform blood tests and stool tests, and then also do an endoscopic examination, like with a colonoscopy or an upper endoscopy, to take pieces of tissue of the bowel and look under the microscope. There are also some imaging tests that help with outlining what areas of the bowel are affected and finding if there are characteristic signs of IBD. There's a QR code here that links out to a little bit more about some of the ways that IBD is diagnosed. And so once there is a diagnosis of IBD, treatment happens next. And this can range from a variety of different treatments. The main part of treating IBD, though, is to target the inflammation. If you remember, the immune system produces too many inflammation substances. And so what the goal of treatment is to target that inflammation to help to prevent the inflammation from causing bowel damage and to relieve the symptoms of an individual with IBD. Surgery sometimes is a part of treating inflammatory bowel disease, and there is an increasing understanding of the role of diet and nutrition in managing the conditions as well. So listed here are some of the main categories of treatment of inflammatory bowel disease. There are some treatments that one would take for a short period of time, such as antibiotics or corticosteroids. And then there are other treatments that are prescribed for longer term. Since inflammatory bowel disease is a chronic condition, individuals remain on medications typically for chronically, going forward indefinitely. Some of those classes of treatments you may have seen on television, as we are thankfully having increasing number of targeted synthetic small molecules and biologics that really target the what's wrong in the inflammation response of the immune system. And then finally, the main goals of treatment of inflammatory bowel disease are to induce remission. Although there is currently not a cure for inflammatory bowel disease, there is a way to make it so that the effects of the inflammation in the immune system is not causing damage in the bowel or in the rest of the body. And so bringing an individual into that type of remission where there's control over the inflammation is the primary goal of treatment, and then maintaining that remission as well. That's where continuing on treatment and continuing on with regular follow-up is essential. There are complications that can occur, and so monitoring the disease and trying to anticipate and prevent things from starting, from occurring is also an important part of continuing to follow with the healthcare professional, even after you're on treatment and feeling well. And finally, improving quality of life, right? So as I mentioned, having inflammatory bowel disease, although it is a chronic condition and can be associated with many impacts on one's life, with appropriate treatment, the goal is really to get you back out to living your best life, to engaging in the activities that you find valuable and meaningful. And so I'll end with just a few takeaways here. Just remembering that there are many reasons why one can have gastrointestinal symptoms, and really getting to the bottom of symptoms that aren't going away is really important. So if you're having any stomach issues, any alarming symptoms, it's important to seek medical care. You can start with your primary care provider, and they can refer you out to a specialist. When you do see any healthcare professional, it's a good idea to share the main symptoms that you're having. But if you're noticing any other, even non-GI symptoms as well, any rashes or joint pains or ulcers in your mouth, those are important to share too. So as a gastroenterologist, I specialize in many different GI issues, and I shared some of those with you. There are others, and it's important to just know that though you may have one type of symptom, it doesn't necessarily mean it's a specific diagnosis, and that's why seeing a gastroenterologist is important. And the foundation can help you with that. So the IBD Help Center is available as a resource to really help guide everyone with gastrointestinal symptoms, anyone with inflammatory bowel disease, and really getting the care and the resources that they need. And so with that, I'll end, and thank you for your attention.
Thank you so much, Dr. Graywood. Such a wonderful presentation. We already have some questions in the chat, and so we'll be getting to those questions later in the program today or this evening. So I would like at this time to introduce our next presenter, Shonda Berry, who's a patient advocate. Shonda, you have the floor.
Thank you, Kanika. Thank you so much. Thank you for having me too. As Kanika said, I am Shonda Berry. I am a patient advocate. I have ulcerative colitis, and my journey with ulcerative colitis started a long 31 years ago. So it's been quite the journey. And that I was 14 years old at the time, and that was the summer of 1994. I was fresh out of 8th grade, excited to be going to high school. In that particular summer, I remember going shopping with my mom and grandma, and we stopped at home for a moment just to use the washroom. And I remember going to the bathroom, and I saw blood in my stool. And that was the first sign of something was wrong, but I did not know what. and I did not share with my mother or my grandmother. Once we left the house and continued on with shopping, I didn't share with anyone. And I didn't have any symptoms for maybe a couple of months until I entered into high school, and then the symptoms came back, and I saw blood again. And then blood went away, and blood came back, and blood went away. That was my primary symptom for a very long time. And I never shared, not as a child, not while in high school, I will say. I went all the way through high school without sharing with anyone because the symptoms was too embarrassing for me. In the community where I grew up and in the household where I'm from, we didn't talk about blood in our stool. So I didn't know how to even bring that to the forefront. I didn't even know how to start a conversation about blood in my stool. So I held that to my chest for so long. There was a lot of anxiety. I didn't know what anxiety was at the time. I do now. I had a lot of anxiety around that. A lot of stress. I was just afraid to share. I was too embarrassed to share because I never heard anyone talk about blood in their stool. So my symptoms came and went all while I was in high school, just the blood in the stool. Once I got out of high school, I started having some diarrhea along with that blood. Still did not share, didn't feel comfortable sharing. So it was a decade went by before I did find out what was going on with me. I didn't know what was happening. And like I said, I never wanted to talk about it. Every night before I went to bed, I just kind of hoped and prayed that these symptoms of the blood and the diarrhea would stop. I mean, it tends to go away every now and again. So I was hoping that one day it would just completely go away. And that went on for 10 years, for an entire decade. And it wasn't until I got pregnant with my daughter that my symptoms went away. And this was the longest time they ever went away. It was the whole time during my pregnancy that my symptoms went away. So I thought maybe, okay, I am healed, cured from whatever was going on with my body. I didn't see any blood. I didn't have any diarrhea. So I thought I was fine until I had my daughter. She was about a month old. She was about a month. It was about a month after me giving birth. And the symptoms came back, and they came back with a vengeance. So I had new symptoms at this point. It was the blood in the stool. It was the diarrhea. And now here comes the pain. And I'm still suffering in silence at this point. No one knows anything. And I'm a new mom. And the pain, oh my God, it was unbearable. But I still didn't share. But what led me to my diagnosis was my daughter. It was because of her that I finally decided to go to my PCP and tell her what was going on, so that I could get the help that I needed. It was 10 long years. I've had a baby. So I'm like, maybe this is something that I can really get some help for. So I made an appointment with my PCP, told her I had blood in my stool. And I guess at the time, well, now I know that it's the indicator that something's going on in the colon or with your bowel. She immediately gave me a referral to see a gastroenterologist. And that was it. She just said, you needed to see a GI doctor. You have blood in your stool. And that's it. So I made the appointment. I saw my GI doctor. I got a colonoscopy, and I was extremely afraid because I didn't know what they were going to find or what they were going to tell me. And at that point, after the colonoscopy, he told me that I had ulcerative colitis, that it is an autoimmune disease. And at the time, I've heard of autoimmune diseases, but I hadn't heard of ulcerative colitis. And he told me that it was manageable, but it was a lifelong disease. So started treatment from that point. He helped me get into remission. But the journey continues. I went in and out of remission. It seemed the older I got, the more flares. For me, stress is a trigger. I have learned that now. I know others' experience might be different, but stress is definitely a trigger for me. And it's been a roller coaster. I will say that. Going in and out of flares, trying different medications and things of that nature just to get the flares under control. And the symptoms, they continue to increase, from the blood to the diarrhea to the pain in my stomach to joint pain to problem with my eyes. So it's been a journey. These 31 years have been a journey. And I have learned to just be open about my disease. I am very vocal now. I don't suffer in silence anymore. I am a patient advocate, so I share very openly, which I think is good for my health. And I am a part of my healthcare team. I am a part of the decision making when it comes to my ulcerative colitis, the anxiety that I have around this disease, and everything else. So I will leave you with, I have learned that throughout my journey that there's like 3 stages to this thing, trying to combat ulcerative colitis, inflammatory bowel disease. Initially you're sad initially I was sad because I didn't know what was going on with me. I didn't know how to express it. And I cried a lot in silence. So I was sad about it. And then once I found out what was going on with me, I got mad. I got really angry because I didn't understand why me? Why is this happening to me? Why do I have to have a lifelong disease? And then I got to the last stage, and that's the stage I am at currently today and will be for the rest of my life while I'm on this journey. I started telling myself, why not me? I'm motivated. I'm motivated to fight against inflammatory bowel disease. I'm motivated to be a patient advocate. I'm motivated to help others. I'm motivated to help the Crohn's and Colitis Foundation. I am motivated to do whatever I can to let inflammatory bowel disease, that it would not allow me to suffer, and I won't suffer in silence any longer. So I will leave you guys with that. And thank you so much.
Wow. Thank you so much, Shonda. So many individuals suffer in silence. And so just to hear your story, I know is definitely inspiring to hear that you did end up coming up with a diagnosis and now you have those answers, and to really turn that pain into passion is amazing. So thank you for being you and continuing to share your story. Thank you very much.
You're welcome.
So at this time, I would like to just provide a brief presentation on some of the resources that we have at the Crohn's and Colitis Foundation and how we can help you either live with your disease, Crohn's disease or colitis, or really seek a diagnosis as it relates to gut health. So just a brief overview of the Crohn's and Colitis Foundation. We have a 2-part mission here. The first part is to cure Crohn's disease and ulcerative colitis. And the second part is really what I do as a part of my job, is really helping to improve the quality of life of children and adults affected by these diseases. So I know Dr. Graywood mentioned briefly about our IBD Help Center. And this is a resource that's available to you as individuals living with Crohn's disease or colitis, or those that are really seeking answers. So we have an IBD Help Center. They're trained master level professionals that are able to provide you with information, guidance, and support around gut health, around IBD. And so you'll see here on the screen, there's a variety of resources that we have, such as support groups, education programs, and resources for financial and insurance assistance. So free brochures, fact sheets. And then also we have we are able to offer 170 different languages. So this is the contact information here on the screen. We also have the QR code there. So I encourage you that if you're seeking answers or need any type of support, to definitely come to our IBD Help Center. We also have a variety of educational materials, so many that is so hard to count and keep up with. And each day, and we're currently just increasing the amount of educational materials that we have, and we're working diligently on that. So we have a variety of brochures that are available on our website. So I encourage you to utilize this QR code. You'll see a list here, but we have much, much more available. So I encourage you to click, to scan this QR code or utilize the link below. We also have a variety of education programs, so similar to this, but we have in person as well as webinars. So if you're interested in attending and finding a local program near you, we have something called My IBD Learning, and that's for patients and caregivers that are impacted with IBD. And if anyone just wants to learn more. So I encourage you, again, we have the QR code here. It's an opportunity to see what's available near you and to see some of our upcoming webinars. And then also we archive a lot of our webinars as well. So if you've missed some of the webinars in the past, this is a great opportunity to get that information and to kind of start your own archive and to start watching some of those on-demand webinars and just learning more. We have a wonderful, fairly new resource called Gut Friendly Recipes, in which it's an opportunity for anyone to come to this website and just learn about recipes that are friendly and available and help the gut. So you can search over 500 recipes that have been approved by IBD dietitians. And it's an opportunity just to learn really more information. You can also search by certain topics, whether that's gluten-free or just anything that you're looking for that you might have some dietary restrictions. You're able to utilize that search bar as well and kind of filter by that. So it's a great opportunity for you to find recipes that are gut friendly. We have a ton of pediatric educational materials, and you'll see a full list here. I encourage you to download this link here to see some of this information. So if you're a parent, this is great for you. Or if you have a child that's diagnosed with IBD, again, another great resource for them just to learn about their disease. In addition to that, an activity book, which is a fun way to kind of learn about it as well. So more information is available through this link. And then we have, this is always an exciting resource for me to share, something called IBD Kids. And so this is a virtual community, support community for kids that are living with IBD. And it's facilitated by trained volunteers. And it's really an opportunity for children to really just connect with one another. It's available to patients in elementary up to rising seniors of high school. So I encourage you to scan this QR code and just to see what's available. And again, this is a virtual option, so you can live anywhere and still participate or have your child participate. We have a Black African American Facebook group that is available to individuals that are interested in connecting with others in this community. And so here's a QR code here to scan. It's really an opportunity to chat with one another, to pose questions, and really to just build a community online. This is our IBD symptom tracker. So if you are experiencing any symptoms related to gut health, any gut issues, I encourage you to utilize this tracker. This tracker is extremely helpful in between appointments, or if you have an appointment with a gastroenterologist or even your primary care physician scheduled. You can track your symptoms in between appointments. And it's an opportunity really for you to kind of keep up with all of this information. A lot of times it's a lot to just remember, what your symptoms are and when it took place. And so this is an opportunity for you to utilize this, and it's a resource for you. And again, if you're looking for a gastroenterologist, we have a resource available on our website. You can scan this QR code here and find a medical expert. And so you'll find one in your local area. And so it's, again, a great resource for you to utilize. If you're interested in just learning more about the Crohn's and Colitis Foundation and staying up to date on our social media, feel free to subscribe to our monthly newsletter. And we also are available on Facebook as well as social media. And again, last but certainly not least, this is our website here, www.crohnscolitisfoundation.org. And it's a great opportunity for you just to learn more about Crohn's disease, colitis, and gut health in general. All right, so at this time, I would like to invite Dr. Graywood back. We would like to enter into our question and answer session. And so, Dr. Graywood, we have a few questions in here, and so we'll go ahead and get started. So the first question is, how much vitamin D would you suggest that we should be getting each day? And is there a possibility that you actually can take too much vitamin D?
So it somewhat depends. For instance, if you have vitamin D deficiency, and depending on how deficient or how low your vitamin D level is, there are different doses of vitamin D to take. So in some ways it depends. There's not a one tablet for everyone. You might notice in like a multivitamin, say for women or men or pregnant women, if you look on the vitamin D amount, there'll be different amounts. So it'll be 800 or 1,000, so it does vary quite a bit. It is possible to take too much. You kind of have to try to do that. So stick to the label on any supplement that you take, and you should be in good shape to take just what's recommended.
Perfect. Thank you, Dr. Graywood. And so a question here states, how common is it to have both, meaning UC as well as Crohn's disease? They're indicating that they were diagnosed with UC and had a full their colon removed and then was diagnosed with Crohn's disease. So how common is that? Or is it common at all?
What was it?
Or is that common at all?
Right. Well, so, the thing is, so it's one or the other really, but the tricky thing is that I've presented to you how clearly Crohn's disease differs from ulcerative colitis. But as life being life, sometimes things aren't totally clear like that. They're not as clear cut. Sometimes we say in medicine that, that you didn't read the textbook, that it's supposed to behave, this way in the textbook, but in real life, it doesn't actually. So all of that to say that sometimes distinguishing between if someone has Crohn's disease or ulcerative colitis isn't totally clear. And even, someone who's thought to have ulcerative colitis, who has surgery for ulcerative colitis, and then later on develop some of the complications or some of the features of Crohn's disease. It's only really then, unfortunately, sometimes that we realize the diagnosis was different, that it was actually Crohn's disease.
Thank you for that, Dr. Graywood. And another question here states, if someone suspects that they have IBD, but their symptoms are mild, are there any immediate changes that they should make to their diet?
So diet is definitely an important thing to think about. I think hopefully if this is you out there, you're looking up a healthcare professional to help guide you as far as making that diagnosis. But yeah, so one thing that we're learning or we're understanding more is that ultra processed foods are not healthy for our guts. So having, a lot of the preservatives and additives and things that are in the food that can last on the shelf for like a decade and look the same, like those type of foods there may actually be some link to inflammatory bowel disease. And so, although a diet of whole foods is not, I wouldn't recommend that that's all you do. You should definitely seek medical attention. But if you can, start to eliminate any processed foods from your diet.
Okay. Thank you. And how important is the microbiome in people with ileostomies? who do not have a colon or even all of their small intestine?
Yeah, so we know that there are bacteria. The microbiome is the bacteria in the gut. We call it the gut microbiome, that just inhabit. It's kind of the environment that they make in our guts, and they sort of live there. And that can differ depending on the bacteria that are in one section of the gut can differ from those in another section of the gut. And so right now, we understand that there can be that difference, and there's a difference in, someone who has inflammatory bowel disease, the bacteria that are in your gut compared to someone who does not. Whether or not the bacteria itself is what's causing the issue, or they're just a marker of what's going on, is not entirely clear. And so the long and short answer is that we know that there are differences, and there are there's probably some part of the bacteria being in the gut that can cause the bad bacteria, quote unquote, that can lead to problems, inflammation. But right now we haven't completely cracked the nut. We haven't completely figured it out.
Okay. Thank you for that, Dr. Graywood. And we have more questions coming in. So someone is asking here, is there a connection between low B12 vitamin and ulcerative colitis?
So vitamin B12 is absorbed in the sort of last section of the small intestine. And that is an area of the intestinal tract that's affected in Crohn's disease, that can often be affected in Crohn's disease. And so vitamin B12 deficiency is something that is, looked for and treated in Crohn's disease. It's not really a feature per se in ulcerative colitis, though.
Okay. Someone was recently diagnosed with diverticulitis. And they've been having a flare. And wanted to know, they've been referred to a gastroenterologist, and could it possibly be IBD or Crohn's disease? Could that be a factor?
Yeah, it's great that you are seeing a gastroenterologist, because getting an evaluation to distinguish between, what's going on in the bowel, if it's due to an issue like diverticulitis, or if actually there are signs of chronic immune-mediated condition like inflammatory bowel disease. That's something a gastroenterologist can do, for instance, with colonoscopy, to take a direct look at what's going on in the bowel.
And someone is asking that when they season or use certain seasonings, it can irritate their stomach and cause diarrhea. Do we know possibly why that is, or what would you suggest that they would do as far as next steps if they're having this challenge?
Yeah, some certain spices, especially, spicy foods, unfortunately, all that delicious stuff that I love too, sometimes can trigger bowel symptoms. And so although it can be a challenge to avoid that, if it is triggering bowel symptoms and, distressing symptoms to you, I think that the safest thing to do is to remove it from your diet.
And so this is gonna be our last question. So again, about diverticulitis, someone is asking, what is diverticulitis and how does it differ from Crohn's disease or ulcerative colitis?
Okay, yeah, we didn't go over diverticulitis, but diverticulitis, so diverticulosis refers to areas in the bowel that have basically like little pouch and outpouching. And those areas of the bowel that have that outpouching can get infected. And so when you have diverticulosis, that you have an infection there, or irritation, inflammation there, we call it diverticulitis. And so this is different than Crohn's disease and ulcerative colitis, which, as you remember, is related to chronic inflammation of the immune system that leads to damage in the bowel. And so although the symptoms can be similar, abdominal pain, maybe some diarrhea, when we actually do evaluations like imaging tests or colonoscopy in diverticulosis or diverticulitis, we would see those outpouchings and the inflammation associated with that, infection associated with that, versus with Crohn's disease or ulcerative colitis, we would see different things like ulcers. And when we look under the microscope, we see that it's due to that immune-mediated inflammation.
I want to thank Dr. Graywood and Shonda for joining us. Thank you for joining us. Before you log out, we do encourage you to visit our website if you have any questions or for information on resources. Our website is www.crohnscolitisfoundation.org. You can also contact our IBD Help Center, which I shared previously, which is 888-694-8872, or you can email at info@crohnscolitisfoundation.org. Thank you again for joining us